Hey there to my fellow PFT schoolmates. I'm going to talk to you guys today about some of the different planes of motion of the body. So first one I'm going to mention is the frontal plane. So frontal plane separates the body right down the center into front and back, anterior and posterior sides. The second plane of motion is sagittal. So sagittal bisects the body right down the midline and separates it into left and right sides. The third plane of motion is the transverse, so that separates the body right at the center into inferior and superior sides. The last plane of motion is the diagonal, but we won't spend so much time on that one. The first joint that I want to talk to you about is the shoulder joint. So right here, and there's a few different movements we do in the shoulder. The first one I'm going to mention is there is flexion and extension, and that happens in the sagittal plane of motion. Then we have abduction and adduction. So abduction is taking away, adduction is coming back, and that is in the frontal plane of motion. As well, we have internal and external rotation of the shoulder joint, and that happens in the transverse plane of motion. Next thing I'm going to talk about is the shoulder girdle. So the shoulder girdle is more your scapula in the back. So shoulder girdle can do elevation and depression in the frontal plane of motion, as well as abduction and adduction in the sagittal plane of motion. There's also, the shoulder girdle is also capable of upward rotation and downward rotation in the frontal plane of motion. The next joint we're going to talk about is the lumbar spine. So that's your vertebrae right across here. The lumbar spine is capable of flexion and extension in the sagittal plane of motion. It's also capable of lateral flexion. So down to the sides. That hurts me a little from my workout yesterday. So that one is in the frontal plane of motion. The lumbar spine is also capable of rotation in the transverse plane of motion. Ooh, that one hurts too. The next joint we're going to talk about is the hip. So, your hip is capable of flexion and extension in the frontal plane of in the sagittal plane of motion. Abduction and adduction in the frontal plane of motion, as well as internal and external rotation in the transverse plane of motion. The last joint we're going to talk about is the knee. Your knee is capable of flexion and extension in sagittal plane, and as well as an internal and external rotation in the transverse